The patient in this video has gingivitis to include generalized bleeding, swelling, and tenderness. Sounds like Miss Jackson doesn't like to floss, so let's roll over here and meet her, shall we? Good afternoon, Ms. Jackson. I'm Dr. Moeller. How you doing?
I'm fine.
Yeah, well, good. I've reviewed your intake history, your x-rays, your exam findings, and I got a bit of good news and some bad news.
Bad news? What do you mean bad news?
So the bad news is about your exam. Everything shows that you have extensive gingivitis. I'm not sure, are you acquainted with this term, gingivitis? Are you familiar with this disease?
What do you mean I have a disease? I'm just here for a checkup. I don't even have pain in my teeth.
Yeah, well, of course, but you do have, what you do have is extensive swelling, bleeding in the gums, which if this is left untreated, it could develop into some serious problems like periodontitis, bone loss, recession, cavities. There's a myriad of things that could happen. This is gingivitis we're talking about, and it's a result of bacteria buildup around the gum line.
What bacteria? I'm not even sick. How did this happen?
Well,
what are you talking about?
Based on your age, you know, and what I'm seeing here, it's mostly just an issue of poor oral hygiene. That's usually what it is. It leads to plaque, tartar buildup around your gum line. This all leads to bleeding, swelling, and the tenderness that you're having right now. So basically, you're just not brushing or flossing correctly. So,
excuse me, poor hygiene. Did I hear you say that? Because I know how to floss, and my gums still bleed when I floss, but you don't know me. And
okay, well, you know, calm down, calm down. Like I said, it's not all bad news. You know, it's just a simple thing that perhaps you're not brushing or flossing correctly, like I said at the beginning. So there is good news.
What are you talking about? So there's more?
Yes.
What about the bacteria?
So, well, there's good news in that we can remove the plaque and the calculus that's harboring this bacteria and causing your gingivitis. Yeah, I've worked out a simple oral hygiene routine just for you. It's very simple. If you follow my plan, all this can be reversed with no further damage to your gums. My assistant has pamphlets on proper brushing and flossing techniques, and you have to do this religiously twice a day. And there's some other sample items, maybe a toothbrush and some floss. And this is all waiting for you at the front desk when you check out. So it was lovely to meet you, Ms. Johnson.
It's Miss Jackson.
Yeah, pleasure. So be sure and check with the front desk and schedule a follow-up appointment about that cleaning we spoke about.
What cleaning? I thought I could take care of that by myself.
Yeah, it was really nice to meet you, Ms. Jensen. I look forward to seeing your progress next time. Okay? You have a wonderful day now. Thank you for coming.